Okay, good. Back health and welfare. And so just talking a little bit about next week, we'll be looking at Act 167 on Tuesday. On Wednesday, we'll have some folks in who can help us understand the very dire straits that we're in terms of healthcare costs and where we are. And then we'll be ultimately next week at some point, we'll be talking of, as we've been talking about electronic health records. We've been talking about the state health plan, and we've been talking about healthcare costs. Those are the three elements that I think I know I would like to work on in here as a committee bill. I'm going to bring a template in for you with some information on EMR, electronic medical records, on second level on the state health plan and how to bring that together. And then thirdly, on what we might do to encourage the development of hospital immediate changes to hospital budgeting process, but then also right now I've asked Jen to draft something up that looks at a 3-year period for developing a global budget, hospital global budgets, perhaps for our 5 biggest hospitals, and then establishing some principles that would go in place that would ensure that when budget costs and payment reform is in place, we're not losing the very services that we need. So those are the 3 sections of the bill. Obviously, I think for most of us, we know that the first 2 are more, the first one is very technical for folks who understand the claims and clinical data information. The second one is really also, again, more of a planning process with AHS and Green Mountain Care Board. And the third one gets to be quite technical and involved in terms of the language that we'll put into the bill. May take a little longer. But those are the 3 areas of the bill. And just to let you know, I have talked with insurance companies, I've talked with hospitals, I've talked with Green Mountain Care Board, Agency of Human Services. There will be disagreements about what to have in that bill, but I think we around this table are going to have to formulate what we see as critical to reducing immediate costs within the budget process. That we can't continue the way we are. And the second one is how we can build a system that ensures a level playing field. We know, obviously we know right now we have the highest per capita costs in the country for hospital, and in particular our academic medical center, which is valuable to us. And there's no value placed on what we're doing. We're trying to save our system.
Well, as Patrick Flood said, that means we are the highest in the world.
That's right.
Because this country is the highest.
Wow.
In the world.
That's
So we are sympathetic to the concerns that are brought to us, and we will continue to work closely and try to get input. Next week we'll start our process for this and hope we can get something out of the committee before crossover. And some of the things that we talk about in here might have to travel down the hallway very quickly, but we'll see what happens. That's it.
I have a question.
Mm.
I'm going to echo what Senator Cummings sometimes says. For the new folks and the relatively new folks, can you get into at some point global budgets and global
Well,
budgets?
that's what we're going to do.
Okay, because I feel like I know what it is, and yet I'm sure I don't know what it is because it's in the context of healthcare. It's called.
Good. This is a good question. This is why we're going to have folks in. Obviously we want to have some experts out there who can do that for us.
Okay.
We also need to think about what's the difference between fee for service, value-based payments, block grants, block payments, and or full capitation. All of those things we need to be clear about.
Madam Chair.
Yes.
When it comes to Green Mountain Care Board, have they ever given us a report on where they spend their money, what they do with their money?
Yes, and they're coming into this week again, and next week again, and you can ask them that question. The House did a deep dive on that yesterday. My suggestion is to take a look at the House committee that, work that was done yesterday. We did have them in earlier. Remember, we had Owen
Yeah.
Foster in earlier.
Mhm.
So yes, and we'll try to look or ask those questions as much as needed to understand next steps.
Cause I was just looking at the Act 167
Yeah.
right here. And it said that we have given 900,000 to AHS for this commitment,
Mhm.
engagement process, I should say. And we gave them $4.1 million for the
Mhm.
engagement process.
Mhm.
For that-
So
for the all
this is the
alignment
question,
stuff?
this is a question for you to ask on Tuesday.
Okay, cause I didn't know if that was the Oliver Wyman, how much. we
Part,
paid.
yeah. Part of it's Oliver Wyman, yes.
Okay,
And then there's another rural healthcare center that's doing work for AHS. They're a consultant. So these are the questions that we'll be asking. And if we need to spend more time on that issue to bring you up, we'll get that done.
it just, just was looking at it, so that's a
Well,
lot
I
of
would,
money.
yeah, no, it is a lot of money.
A lot of money.
There's a lot of work. And the thing that we all have to be aware of, we have to invest if we're going to get the results. It's hard to see that, but it has to happen. If we do, you will hear on Wednesday, that if we do some of the things we project we can do in a committee bill or in a bill of any type, we could realize $100 million reduction in costs, savings, let's just call it savings, the first year. So $4 million pales in comparison. So that's the kind of question we have to ask. And then we have to ensure that we get the results that we're being told we can get. And I'm not saying that, but I'm hearing from folks that this can happen, and I'm just as skeptical, but I'm also slightly optimistic. And if we don't do something, our hospitals and our commercial insurance companies will not be here, and they'll be in the red.
We'll go back to having a 20% uninsured.
Yes, we'll lose healthcare coverage for so many people. So anyway, that's all I want to share with you about next week. And what else do we have on the agenda, Kiki? Is there anything else there we should be talking about? Okay, that's good. This is really important for us. I think it's probably one of the more serious things that we have to think about. I think we all feel that way. And I think if you take a look at the House Healthcare meeting, I think it was yesterday. It was yesterday, the day that Owen Foster was in there. He spent several hours.
Oh, we can do that this weekend.
Yeah, I do. I ask you to do that. It would be good prep. And then, we may be meeting, are we meeting with House Healthcare on Wednesday, and we'll get a room for that. That's cool. Okay. So we're working together. We're starting with this issue. And the House will pick it up after we work on it. But it's not something that we could have had a bill drafted before now. So it's just, we'll get there. We'll get something on the table to look at, and then we'll all have a chance to hear the testimony and work on it. So we can go off live, and we're going to adjourn for the day.